Okay, the next one after that, we now need to visualize the pathophysiology. Now, for the pathophysiology of neuropathic disorders, you need to know that what there are different complications that you can have in neuropathy. Is it clear? And the complication that we have mostly in neuropathy is going to be associated with decubitus complications. Is it clear? They are prolonged decubitus complication. Prolonged decubitus complication generally. Is it clear? When you have a prolonged decubitus complication, is going to be the pathology that is going to be associated. So particularly the prolonged decubitus complication are the pathologies under which you have a somatic neuropathy. When you have a somatic neuropathy, you are going to have prolonged decubitus complications. Is it clear? And then the next one is when you have the next one, which is autonomic neuropathy. When you have autonomic neuropathy, you can have other disorders. Particularly if you have a sympathetic nervous system neuropathy, you can have what is called an orthostatic hypotension. Is it clear? You have orthostatic hypotension. Orthostatic hypotension because normally the sympathetic nervous system is the one that is going to increase the venous tone for you to have a venous return when you stand up. But when you stand up, there is no sympathetic nervous system that is going to activate that venous tone. Is it clear? So you are going to have a pool of blood inside your lower limbs. Is it clear? When you have a pool of blood inside your lower limbs, it's going to hypoperfuse the brain, and thus you are going to have a syncope. You are going to lose consciousness. So that is orthostatic hypotension, or it's also called a neurogenic hypotension. Is it clear? Now, the next thing that you can have when you have a sympathetic nervous system disorder, you can have hypotension just because of sympathetic nervous system disorder. Hypotension, a chronic hypotension, because the sympathetic nervous system is a major system that is involved in regulating the blood pressure. Is it clear? These patients are easily going to have hypotension, are easily going to faint. Even without changing position, they are going to have chronically hypotension, because of a sympathetic nervous system hypoactivity. Now, if you have a parasympathetic nervous system hypoactivity, in this case, you're instead going to have things like constipation. Is it clear? Because you are going to have you have abnormal peristalsis. There is no peristalsis for the parasympathetic nervous system activation. Is it clear? You are going to have malabsorption because the parasympathetic nervous system activation is involved with digestion and all the other ones. You are going to have malabsorption problems. Is it clear? Lose weight. You have malabsorption and all that. Is it clear? You have also gastroparesis, which is indigestion. Is it clear? So those are the different elements that you can have in the parasympathetic nervous system, autonomic nervous system neuropathies. Now, in somatic neuropathies, usually associated with the prolonged decubitus complications. Now, we are now going to assess now the complication of prolonged decubitus. You start from the central nervous system. Generally, a complication of prolonged decubitus in central nervous system, you have depression. Is it clear? You have depression. The second one, you have anxiety. So those are the complications in the central nervous system: depression and anxiety. The next one, you have the cardiovascular system. The cardiovascular system, you are going to have things like, the first one, you are going to have pulmonary embolism in the cardiovascular system. You have deep venous thrombosis in the cardiovascular system. In the pulmonary system, you need to know that you have pulmonary embolism and deep venous thrombosis. The mechanism is that you have reduced muscle pump mechanism. So there is reduced backflow of blood because the muscles are not activated when you have a neuropathy of the muscles. Is it muscular a motor neuropathy? The muscles are not activated to do venous flow, so it's going to accumulate and result to thrombosis formation. In the pulmonary circulation, since you are not going to exercise, you are going to have what is called pulmonary stasis. Is it clear? You are going to have pulmonary stasis. Now, if you have a problem in swallowing, particularly in the case of an amyotrophic lateral sclerosis, or you have a neuropathy involving the nerves for swallowing, which are the cranial nerves. Is it clear? You can have it in amyotrophic lateral sclerosis or other type of disorder. So if you have a problem in swallowing, you are going to have what is called aspiration pneumonia. Is it clear? You can have aspiration pneumonia. You can have also pulmonary and pleural effusion, but pleural effusion is going to occur, because the backflow of blood is also going to be via exercising. So you are going to have pleural effusion, which can also occur. Is it clear? And I hope you already know the two major so those are the two major types of pleural effusion, which are exudative and transudative. In this case, you're going to have a transudative pleural effusion. Now the next thing after that, okay, the next thing after pulmonary causes, you have now in the abdomen. Is it clear? In the abdomen, the GI tract, we are going to have fecalomas. Is it clear? Since you are not exerting the abdominal muscles, you are going to have also accumulation. Is it clear? So you are going to have fecalomas. The next one is constipation. The fecalomas is going to result to chronic constipation and may also result to intestinal obstruction signs like vomiting, abdominal pain, and all that. Is it clear? Now, after the GIT, you have also the urinary system. In the urinary system, you may have incontinence, and the incontinence that the patient usually have is functional incontinence. They don't have energy to move from one place to another. They don't have a muscular activity to move from one place to another, so they have a functional incontinence. The next thing, after having this incontinence, they can have also a urinary tract infection. Is it clear? Since they are urinating on themselves, there is poor hygiene, they are prone to urinary tract infection. Is it clear? So those are the different elements that you have to put in mind. Now, also I've forgotten to speak about the fact that what if you have also a parasympathetic neuropathy, you can also have a problem with erection. Is it clear? You have a disorder of erection. Is it clear? And you have also a problem with urination. Is it clear? So if you have a parasympathetic nervous neuropathy, a parasympathetic nervous system is going to cause an erectile dysfunction and also a urination dysfunction, where you're going to have instead an acute urinary retention from a neuropathic bladder, because the parasympathetic nervous system is the one that causes the contraction of the bladder. Is it clear? Also, in sympathetic nervous system, you are going to have a problem with ejaculation. Is it clear? Because the parasympathetic nervous system the sympathetic nervous system is the one that is causing ejaculation. And also, if you have a sympathetic nervous system neuropathy, after ejaculation, you have a problem also with starting menstruation. Is it clear? You have a problem with starting menstruation, because the sympathetic nervous system is the one that causes the opening or the relaxation of the internal sphincter. Is it clear? So those are the different things, internal urinary sphincter. Now, the next complication of decubitus after the urinary system, is it clear? We are going to have the musculoskeletal system. Musculoskeletal system, since the patient is always lying down, we are going to have osteoporosis. Is it clear? Osteoporosis, and that osteoporosis may result to hypercalcemia, because the patient is also always lying down, and also result to fractures. Is it clear? The patient is always lying down. When you are always lying down, it means that the blood is accumulating around the bones, so the blood is going to dissolve more of the bones, resulting to the more of the calcium of the blood of the bones to enter into the blood, resulting to hypercalcemia. And when you have osteoporosis, there is fragilization of the bones, which can result to fractures. Now, seeing of the musculoskeletal after osteoporosis, you can have a proximal amyotrophy. Is it clear? It means that the muscles of the proximal regions are going to amyotrophy. Is it clear? Because or it's also called a disused amyotrophy. You're not using the muscle. It means that you are going to become cachexic. The muscles are going to be atrophied. Is it clear? So a proximal amyotrophy or proximal muscle atrophy. That is for the musculoskeletal. So those are the complications that you can have. Now for the integumentary system, is it clear? Since the patient is always lying down, he's going to have pressure sores. Is it clear? Pressure sores or the pressure ulcers. Particularly if this pressure sores as a result of neuropathic disorders, is it clear? It is going to be called a neuropathic ulcer, and this is where you have now the complication of that neuropathic ulcer. The neuropathic ulcer can come either from two mechanisms, because one, a somatic disorder. Is it clear? When you have a somatic disorder, you cannot feel. Is it clear? Since you cannot feel, it means that every time you're going to wound yourself somewhere, you cannot know that there's a wound there. Is it clear? And it can also result to the ulcer. Why also another mechanism of neuropathic ulcer can also be a motor neuropathy. Is it clear? And in motor neuropathy, you have to note that what in motor neuropathy, here you cannot move. So the formation of ulcers in motor neuropathy are more in pressure source. Are going to be located on the pressure areas, and there are peculiar pressure areas in the body. The pressure areas of the body are the areas where you lie down, where they are the bony prominent areas, and where you lie down. Is it clear? Particularly the level of the foot, you have the calcaneum. Is the calcaneus. Is it clear? That's the heel of the foot. The calcaneum, that's the heel of the foot, is one of the areas where you have that. The second area, you have also at the level of the knee, you have the level of the trochanteric regions, you have the level of the inferior board, the borders of the scapula, the posterior border of the scapula, you have the level of the elbows. Is it clear? You have the level of the occiput. Is it clear? So those are areas where you have pressure source. So from here we can now continue with the next part.